Hello and welcome to the Quiver channel. I am Jason, your host, and I hope you're all having a wonderful, splendiferous day. Over the last few days, I had some comments on my videos that I replied to. That person has deleted all their comments, probably for the best. But they are what's wrong with the NHS. They are what's wrong with the medical health service, especially the mental health service. This was the person who basically told me, oh, you shouldn't have spent that money on computers. You should have spent it on sorting out your room and making it look better with furniture and all that kind of bullshit. That kind of person is the same kind of person that causes people like me to have an end-of-life event. Let me take you back to 2019. Paolo had died in 2018. I had no anchor. I had no connection to anything. I was spiraling. My bipolar, my ADHD, my autism and everything were freewheeling, and I was losing it completely. I had no focus and connection to everything. And there was 5 doctors who were trying to help me. They kept passing me on to different people and different levels. I went to all of the government mandated help for mental health, from the STEP system, the therapy sessions, the going to the group therapy and all that. I did it all. I did it all. My doctors also, and none of it worked. None of it worked. None of it made me any better. In fact, every single thing made me worse. Not subjectively worse, but actual worse. It's in my notes, medical notes. It's documented that everything they were trying, there was pushback from my GP in that because this wasn't working. It was getting to the point where my GP was actually expecting a phone call from the police to let them know that I'd ended my life. My choices were coming down to 2 choices. A PICU, psychiatric intensive care unit, basically section me and take me in and try to stop me from ending my life, or an end-of-life event. Those were the 2 choices. The medication made me even more suicidal. Because one of the things is, when you've got ADHD, bipolar, and autism, those things interact together. And when you try to fix one part without dealing with the other parts, you destabilize everything that's kept them alive for the rest of their life. I was basically weeks away from the end point. I had a plan. I was in such bad condition, and this is something a lot of people don't know, that Samaritans actually called me every week to see if I was still alive. You can, if you're in a really, and I mean a really bad way, because they don't really have the money and the resources to do this for everyone, you're in a really bad way, and you give them permission, they can check up on you. They can ring you a week later to make sure that you haven't, and make sure that you're not a statistic. The only reason they didn't section me, they didn't do that, was because they believed that if they tried to do that, I was intelligent enough to actually take that as my trigger to finish it off before they could. I didn't want to be alive. I was experiencing my wife's last 30 minutes of death every hour or two. I would go catatonic in my house. I would sit down on the stairs or on the floor in the living room, and I'd look up and it'd be night time. And my only thing that had kept me going for years and years before that, computers, technology and gaming and VR, was losing connection with, because everyone in the fucking health service was telling me, you've got to get out. You've got to go and do this. You've got to try this. They were following their fucking checklists and trying to remove me further and further away from my safe room, from my technology. All these experts were telling me that, no, you can't do it that way. It doesn't work. Some of the worst mental health professionals are ones that don't fucking listen to their patients. Remember, if you're a mental health professional, you probably got 30 minutes with this person, but that person is dealing with his mental health and has just about survived and hung on for his entire life. Maybe listen to them. Maybe take your cues from what they say. Now, I would call this person out, but they deleted their comments, and so I can't remember the name. I mean, a few of you probably replied to them and that, but I don't have access to their comments anymore. If you do have access to their comments at all before that they put on my videos, the last few videos, please contact me, and if you know me on Discord, send me copies of them. I would like to show people just exactly what stupidity and moronic attitude these people. He was saying, oh, I work in mental health, oh, blah, 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 this is what you do, you need to do this. Sorry, I didn't know that you had access to my medical notes. We had access to my therapist notes, that we had access to my mental health professional notes, the time I was at the mental health areas, the times when I was taken in by one of the main setups for mental health in the UK, and they read through my notes, and in the first meeting it was like, we can't help you. Let me refer you to this person because we can't help you. That's what they told me. And it was that last person, the person that finally signed off on everything, can actually put me on the route of, yeah, you're okay using computers. It works for you. You're okay using your safe space. It's okay that you might never be able to leave your house or function out there as a productive member of society. The fact that you're not dead, and that's what he basically said, the fact that you're not dead is a positive. That is the person who started to put my virtual reality and gaming and everything on my actual system. And if you go back to my 2019 videos where I spent so much time doing all of this to try and stay alive, you will notice how over the months and that I changed. I became more centered. I had more control over myself. I functioned more. But there's a limitation. There's big limitations. And the thing is, as you get older, ADHD, autism and all that can actually get worse. Your control of it slips, your ability to mask goes away, and you deal with massive issues. And the depression can hit in different ways. This is why I've got thousands of coping strategies that work, that are documented by medical professionals with 40 years experience. I feel sorry for anybody who deals with these mental health professionals who believe they know better, who believe that they don't have to listen to their patients, that they believe that their way is the only way. I tried all of those ways. I went through all the system, and it almost cost me my life. Until I was passed on to a senior mental health professional who thankfully had a couple of slots free for someone new. It was the Hail Mary to just see before they knew I was going to end it all. This isn't a, oh, just do this, just push through it, you can do it. That's some of the stupidest things that this guy on my comments said. I hope he was just lying, though he wasn't a mental health professional, because I feel sorry for anybody dealing, because he will convince people that the only reason that they're not doing well is because they're not following this 10-step plan, that they're not doing the way he says it works. Every single mental health patient is different. And every single mental health patient who is struggling has actually managed to struggle and just about survive. They're asking for help. They're not asking you to get out your book of 10 steps or your scripted responses or your checklist. They're asking you to fucking well listen to them and formulate a plan that works with them, not against them. Not to destroy everything that they've done themselves and try to say, oh, you can't do that. That doesn't work. These people are the worst mental health professionals. And I was so lucky, so fucking lucky to have someone who actually cared, who actually read all of my notes, who said to me, how the fuck are you still alive? And his exact words were, how the fuck are you still alive? I've had people dealing with half of what you are, and we sadly haven't been able to save them. He had no ego. He had no, oh, I'm right, I know all these things. He had 40 years experience, and he was one of the top tier ones in Staffordshire and Stoke-on-Trent. He was always boot solid because he was so good. I was just very lucky that I got to talk to him instead of another one of you fucking idiots who just said, oh, let's try this thing, instead of actually listening to me. He asked the question, how are you still alive? A question that no mental health professional of all the 5 ones before had asked me. How are you still alive? And from that point, we developed a personal, unique treatment system. Thankfully, I've also got an amazing therapist who is autistic. And I believe that when it comes to therapy, if you're a neurodivergent, then there should be more support for you having a therapist who is also neurodivergent, because they will be able to understand you far better than people who aren't. Anyway, this was a bit of a rant. So bye-bye for now.